Our next speaker, Doreen Wong, I've known quite a long time. She used to be on the Komen LA County Board of Directors. I'll let her explain her positions when she lived here in LA. She doesn't live here anymore, so she traveled for a ways. And she's what I'm trying to get across to the world is there are cultural barriers that stand in the way of access to care. And one of the big ones is that they don't want to talk about it. And I think that because of her past background, she can tell us quite a bit about these barriers to care that get in the way of somebody successfully navigating through metastatic breast cancer. Doreen, come on up. Who says that? Come on up, Doreen. By the way, Doreen is metastatic. My friend.
Good morning, everyone. Thank you so much for allowing me to participate with you today. Thank you, Mark and Komen LA and Sharon especially. My background is in my former life. I was a nonprofit CEO and spent a majority of my career advocating for equal access for underserved communities. And I primarily dealt with education, employment, transportation, but when I was diagnosed in 2006 with breast cancer, I noticed there was another barrier. I'm trying not to speak fast because I want to allow the translators to keep in time with me, but the barrier that I found being born here was there was a lot of assumptions because I was Asian. And some of them occurred where doctors wouldn't speak directly to me, like the way they explained things was like I was another person. And that bothered me. Being an advocate, that really bothered me. And so I started to look for resources. Who do I need to talk to so that I can become better educated? Thankfully, there was Komen, but I also had a very good friend who worked at the Cancer Legal Resource Center. I was like, okay, if anything goes wrong, this is who I'm calling. And she said, just be yourself, because your cancer is your cancer. And I thought, okay, I can be myself. So the next doctor appointment I went into, and my surgeon said, you know, Doreen, most people think I'm a very good surgeon. I said, well, I guess I'm not most people, because we need to have a talk. And it was at that moment that I took on the role of an advocate. You know, one of the reasons I'm so happy to be here is because when you get this many warriors, survivors, thrivers, and caregivers in one room, the whole environment shifts. And if each one of us carried that sort of love and support and hope and empowerment when we walk into the doctor's office each time, things will start to change. I was reading, actually it was a YouTube video. Robin Roberts was interviewing this beautiful woman, and she was sharing how 11 people in her family had been touched by cancer. One of them actually passed away, unfortunately. 3 generations, this spanned 3 generations. 3 generations of women in the living room mourning the loss of her cousin, and they still weren't talking about cancer. She referred to it as the monster. And she said, well, if we didn't talk about it, I guess somehow it didn't really exist. And that's so not true. You know, Asians, we don't really talk a lot about what's going on in our family, our personal life. And when I was re-diagnosed in 2018, I realized that I didn't talk about it. For as much as I advocate and educate and help, I didn't talk about it with my family. And the only reason why I knew is because in different ways, in their own ways, they all said, I remember you had cancer, I just don't know anything about it. This time, will you please let us help? And I thought, oh, shame on me, because I had excluded my family from one of the most important journeys of my life, which was fighting for my life. If everyone in this room, and to talk about cancer health disparities in 15 minutes, there's no way. But there's a theme, and it's communication and resources. A lack of communication, and a lack of knowing where resources are. So how do we fix that? Education and outreach. Across the hall is a room full of vendors, and if you haven't done so, please go see them, because those are your resources. You don't have to know everything about cancer, your treatment. You just need to know you and who to talk to. And I think part of it is being able to now go into communities of color, with cancer ambassadors and warriors of color to speak one-on-one on what their journey is. And not in so much of a scientific way, but in a social way, in a human way. Because a lot of the fight, at least for me, and you all can shake your head or say, no, that's not my story, but at least for me, a lot of it is mental. Being able to mentally get up and move forward with my day and not want to just stay in bed. Because there are days where you just want to stay in bed. And then you remember your mom, your husband, your kids, and you're like, okay, I could do this. But for them, they need to be able to give that back to you. And so for me, it was allowing my husband to actually lift me out of bed some mornings. So he was on this journey with me. When I was first diagnosed, in 2018 again, I was actually waiting in the office for an MRI CT scan, one of the ones that I had to do. And this young woman came in. She was probably in her 20s, a little cute toddler in tow, but she was frantic. And you could feel the stress and the anxiety she was carrying into the room with her. And she walks up to the counter, she's signing in, and the nurse says, "Who's here to watch your child?" And the woman said, I am. And well, we can't allow you to take your CT scan with your child. You have to come back. You'll have to reschedule, you'll have to find a babysitter, you'll have to do, and I understand where the nurse was coming from, but this woman was in tears. I don't have anyone else. Well, you'll have to pay for a babysitter. I could have paid for a babysitter, but then I couldn't have fed my child. That's a disparity. I went home and I had to look for a resource because I felt like that's not an isolated case. There are single parents, men and women out there, who are facing these decisions. And when you're trying to get better, fight your cancer, you don't need the stress of that. So in the other room is an organization called Remember Betty, and they provide financial assistance for babysitters, for groceries, I didn't know that until I looked. The other part of education and outreach is now legislation. You know, and Dr. Ponce is here. And she has a booth outside as well. And she's asking for MPC patient survivors to please stop by and talk to her because she wants to know our experience so she can write legislation. We shouldn't have to go into debt to get better. We shouldn't have to decide between feeding our child and buying medicine. And I want to reiterate and thank Sharon for having the courage and the, not gonna get emotional, and the foresight to ask for a change in how we talk about cancer. Because, I mean, I love hearing the statistics and the numbers, but I'm not a number person, I'm a person. And while we can have all these medications, we need to be able to help each other and touch each other as human beings and say, you're okay, we'll get through this together. And if you don't have someone in your support system, you are looking for another support system. Komen's going to create these wonderful Facebook groups. How many are on Facebook? Find one of them. They're going to be created in specific languages so that they can put materials relevant to a community, because we're not all the same. We don't approach cancer the same way. And we need culturally sensitive information to be able to share. We need doctors to understand that there's cultural sensitivities when treating us. We need to know that clinical trials need to do better outreach into communities of color so that there's an accurate representation of cancer patients in the clinical trial. So, in closing, I encourage all of you, please see the vendors, please see Dr. Ponce, please connect to Komen. If you have a question, you could call into Komen. If you have a question, my card is across the way as well. Come talk to me, because I don't want anyone leaving here today like they don't have someone who's willing to listen. Thank you so much for your time.
Wasn't she incredible? I think we go home now, right? That was incredible.